primed to act on it in 2009. Let's make it happen. Thank you all very much for the opportunity to be with you tonight. Thank you. Thank you. And we've got some time. Yeah, can take questions. I don't know if there's a roving microphone, so I'm going to start over here.
You did mention the idea of prevention. And it seems to me where the prevention can really be started is getting all children having health care. And it's not
health
that
insurance,
good.
You mean?
Yeah, the CHIP program which you mentioned.
Right.
And it's been cut. That budget has been cut in the federal budget that just came out. There's not enough emphasis on that stage. If you get the kids started early, you're not going to have some of those other things happening later. So I really think that that's where one of the major things has to become. The other place where medical costs are so high is that 30% in the cost of figuring out insurance forms. The hospitals and the physicians spend 30% of their time doing that. And by having multiple health insurance programs don't seem to do the job. Their profit's the main thing that they're worried about.
Well, let me comment on that point about administrative costs. I'm not sure they're quite 30% of the costs in our healthcare system, but they're a lot, and they're a lot higher than they could be. And I think there are some real benefits to having choices of insurance plans around. If we didn't have choices of insurance plans, we wouldn't have gotten to a lot of the steps that have now been proven to work for better coordinated care for people with chronic diseases and for new kinds of wellness programs. Those kinds of programs were not started in the traditional Medicare program or traditional Medicaid programs, which were much more of the fee-for-service variety that I was talking about earlier in my remarks. But there is, I think, a lot more that we can do to prevent all of the additional administrative costs from non-standardized forms and the like. There have been some federal efforts underway to try to get to standardized ways of sharing information about patients, basic information on care. And the other big place where a lot of these costs comes in are related to underwriting costs, where plans are competing not by offering better care at a lower cost for people who are healthy and for people with chronic diseases, but by trying to offer plans that focus just on the healthier people and trying to avoid those with pre-existing conditions. A lot of the reforms that have been talked about and some that have been implemented already in places like Medicare and Medicare Part D prohibit any kind of underwriting based on pre-existing conditions. You can't just prohibit it, though, because that creates some other problems in health insurance markets. People who have high cost, or people tend to